So now we proceed to the segment 4, which is the lower extremities. Throughout the leg assessment, note the leg's active range of motion, muscle mass, and strength. To assess the vascular system, inspect the patient's legs, observe their skin color and condition, hair distribution, and toenail integrity. Look for abnormalities such as symmetry, venous patterns, lesions, and edema. Using the back of your hands, check the temperature of the legs from the feet up. It should be warm and symmetrical. Now, flex the patient's knee and compress the calf muscle against the tibia, release the pressure. And then dorsiflex the patient's foot. Neither action should cause pain. Locate the popliteal pulse, bend the patient's knee and feel for the pulse in the popliteal fossa. Next, palpate the posterior tibialis, pulse in the groove between the medial malleolus and the Achilles tendon. Assess the dorsalis pedis pulse by palpating lightly lateral to the extensor tendon of the great toe. Check for edema by pressing over the tibia or medial malleolus for 5 seconds and then releasing the pressure. Normally, finger pressure does not leave an indentation or pit. If it does, grade the pitting on a scale from +1 for mild pitting to +4 for severe pitting. Continue to assess the legs by evaluating their sensory function as you did when you tested the sensory function of the arms. Assess the patient's legs for light touch sensation, pain sensation, temperature sensation, vibration sensation, and position sensation. Test the quadriceps reflex. Have the patient sit up with his legs relaxed and dangling over the edge of the exam table. Place one hand above the knee, then tap his patellar tendon with a reflex hammer. The lower leg should extend and the quadriceps should contract. Test the Achilles reflex. Have the patient bend his knee, rotate his hip outward, and dorsiflex his foot slightly, then tap the Achilles tendon with the reflex hammer. The normal response is plantar flexion. Finally, test the plantar and Babinski reflex. To do this stroke the lateral aspect of the sole of the foot from the heel upward. The normal response is plantar flexion with no toe fanning or great toe. If any of the patient's reflexes are hyperactive, check for clonus, an abnormal pattern of rapidly alternating involuntary muscle contraction and relaxation. Lightly support the lower leg in one hand and dorsiflex the foot with the other hand. Normally, you should not see extra movements or contraction in the leg during the next part of the assessment. You'll evaluate cerebellar function for the heel to shin test. To place on heel on the opposite knee and slide it down to the ankle. He should be able to do this in a straight line on the shin. His gait and gross motor function, instruct him to walk 10 to 15 feet towards me. Turn, and then walk back towards you. Her movement should be smooth and coordinated. Her arms should swing freely and she should turn without losing his balance. Now, perform the Romberg test to stay. Have the patient stand with her feet together, her arms at her sides, and her eyes closed, standing close to her. Observe her for 20 seconds. She may sway slightly but should not lose her balance. This simple test assesses the acoustic nerve, position sense, cerebellar function, and muscle strength. Tandem walking. Have the patient walk heel to toe in a straight line. He should be able to walk in a straight line without losing his balance. Thanks for watching.